Culturally competent specialty care for children, including medical day care, is especially needed in our area. We discuss this and more on the next Latino Motion. Join us.
Latino Motion with Bert Lopez is presented by Latino Motion Public Affairs Media, a New Jersey nonprofit corporation. Join us online at www.latinomotion.tv. Find us on Facebook and YouTube. We encourage your comments and contributions for show topics. Funding for Latino Motion is provided by Atlanticare. For more information, call 1-888-569-1000 or visit atlanticare.org. Atlantic City Electric, energy for a changing world. And South Jersey Gas.
Welcome to Latino Motion, a weekly interview show highlighting issues impacting New Jersey's Latino community while advancing understanding of Latino cultural heritage and contributions to our society. And here is your host, Bert Lopez.
Buenos dias and welcome to Latino Motion. Acute rehabilitation services and medical day care for children are a major need in Southern New Jersey. We discuss the expansion of these programs to help meet this need. Joining me is Michael Rosiak. He is the Chief Operating Officer of Weisman Children. Michael, welcome to Latino Motion.
Thanks for having me, Bert. I'm excited to be here.
So the medical services that you run, the Weisman Children, I really love the mission statement, which is basically to unlock the potential of every child every day. Tell me a little bit about the organization.
Well, first and foremost, believe it or not, in today's healthcare, we're family owned and operated. So organizationally, we started back in 1982. The state of New Jersey approached Bart Weisman, thus Weisman Children's, and Howard Lipschitz, who were managers of long-term care nursing facilities, and asked if they'd be interested in extending those services in pediatrics. In 1987, they opened up their own program called Voorhees Pediatric Facility, in which we took ventilator patients from around the state. Today, it's the largest freestanding ventilator program in the country.
Now, on the offset of the program, mentioned the fact that there's a real need in Southern New Jersey, right? Particularly for children. Are there very limited services here?
Well, I think the nature of the beast is that if you think about pediatric specialty needs, it makes up maybe only about 2.5% of the population. Okay. So just by the nature of that small percentage, why would people be involved in providing those services? We find that, A, there's a great need, and the service that we provide for the 2.5 to 5% of the population represents 60% of the healthcare spend in pediatrics. So there's such a need, and if it goes unmet, the children are suffering from lack of services, and the cost will continue to go up.
And obviously, without these services, it's a significant impact to the whole family.
100%.
Right? Let's talk about what we mean by rehabilitation services for children and also the medical day program.
Sure. So Weisman Children's opened in 1997 as Weisman Pediatric Rehab Hospital. In 2003, after its namesake, we renamed it Weisman Children's. The inpatient rehab hospital really takes kids from tertiary community care services that require acute rehab after some type of traumatic incident. Could be as basic or simplistic as concussion protocol and helping them through that. Could be as dramatic as anything from car accidents to even worse, gunshot wounds. Those patients get treated in the community and then come to us for rehab to get them back on their feet and try to get them back to their original baseline. Medical daycare is a whole totally separate program. That's for kids that have specialty care needs from birth to 6. We pick those children up, bring them to our site every day. And those kids historically, because as you mentioned, a lack of services, Bert, Those kids if the families can't get services for them, they're unable to work. So by us being able to create these medical daycare programs, we bring the children to our programs, and that allows the family to have a more normalized work environment as well, while giving great care to the kids.
What makes your services different compared to maybe when you first started?
Sure.
Obviously, there's been a lot of advances.
Yes.
Right? So I'm sure technology also comes into play.
Sure. As I mentioned, the ventilator management programs, both at Voorhees and at Weisman Children's, we're able to take kids today because of technology advances. Kids are saved much earlier. So there's a lot greater need for specialty care through early ages, early onset neonatology, through pediatrics. It's one thing we find in those services as we provide them to our population is that the kids need the service, but the family needs the service as well. One thing that we find in pediatrics is we're treating the family as much as we are the patient.
That's a great point. And, particularly I'm thinking about the Latino family where, it's really just getting the services is very difficult. And we'll talk more about equity later on in the show. But getting the family engaged is certainly very critical. I did have the opportunity to visit your facility up in Vineland, and a big tribute to how all this works is the staff, right? Being able to work with families, not just the children, but working with families as well.
I believe our staff, I think some things are made more complicated than they need to be. I think it's as simple as treat people the way you want to be treated and have a judgment-free zone in all that we do. We don't walk in our family's shoes, so we don't make any assumptions about anything except we try to best listen and understand what their needs are. Violent particularly, there's all different types of challenges, which we'll talk about later. But it's great that our staff actually really understand and really just want to be there for the children and for the families.
I guess the technical term for it is family-centered approach.
Yes.
Right? So exactly what does it involve, right? In terms of, do other families engage also in the care as well?
So we create in different programs, there are different types of what we call care plans. So the care plan has input from nursing, from different therapies, occupational, physical, speech therapy, physician services, nutrition. All those people weigh in. But it's not in a silo where everyone's just looking at it from one perspective. So we talk about putting the patient center. So it's patient-centric. And also include the family. So when we're making decisions on how to progress in care, there's active dialogue with the family so they understand every step of the way what we're trying to accomplish.
So I'm assuming that this also involves training of the family members as well.
Yes. And that training can be in preparation to go home. So if you're in our inpatient hospital program, we're not only working with the family in preparation to go home, but also making sure community resources are in place. So that through home care companies, through nursing agencies, for whatever the service is, we're connecting them with the families before they leave us.
So you're also connecting those families with services outside of the services you provide.
Absolutely.
All right, let's talk a little bit about access. Right? That's always a big issue. And you mentioned it's a small population, but yet you have to have the services for these individuals. Tell me how far you spread out throughout South Jersey, because that's the key, right? You can't just have one central location and expect everyone to come there.
So if you think about Weisman Children's and even Voorhees Pediatric Facility, it's a continuum of care. Okay. So we might meet the patient for the first time in our inpatient rehab hospital, which is only 18 beds. It's not a large inpatient hospital. However, as they get ready to transition back in the community, they may no longer require medical services. They may be stable, but still require rehabilitative services. So they then would transition to our outpatient services. And they can receive OT, PT, and speech in those services. We will talk a little later about Weisman Cares as a program specific to this to meet some of these needs. But out of those programs, we can also have children come to us from the community or from hospitals and enter into our medical daycare programs. And that's the program for kids from birth to 6.
It's certainly when we're talking about specifically within a Latino community, being able to connect those families to services that are perhaps very difficult for them to do on their own, and I'm assuming you have case managers that also help through that transition.
So we have a program called Weisman Cares. As we transition kids back into the community, we not only keep our case managers intact, but depending on the disease state of the child leaving the hospital, we may stay connected with that family for up to 15 months. That's unheard of. Most acute hospitals, maybe 2 to 3 months, they stay connected. For us, we believe the success is being there to when there are difficult times, to be able to offer options. And we find that in the inner city and the underserved populations all the time.
Absolutely. We want to continue this discussion, a lot to cover.
Sure.
We're just going to take a quick break. We'll be right back with more Latino Motion.
Latino Motion with Bert Lopez is presented by Latino Motion Public Affairs Media, a New Jersey nonprofit corporation. Join us online at www.latinomotion.tv. Find us on Facebook and YouTube. We encourage your comments and contributions for show topics.
Welcome back to Latino Motion. We continue our discussion with Michael Rosiak. He's the Chief Operating Officer of Weisman Children. Michael, we were just talking about how you have that family-centric approach to serving the children and the families. Let's talk about specifically about the programs themselves. Now, obviously, there's 2 tiers here. You got you have the inpatient as well as the outpatient. Let's talk about rehabilitation in terms of what those services are first.
Sure. So we offer occupational therapy, which tends to be fine motor skills and working on different types of developmental issues, physical therapy, more gross motor skills, and speech language pathology, and dysphagia, both communication and also feeding and swallowing. Those are our core in our outpatient sites. We recently have introduced nutritional services because of the need in the community. Right. So we now offer nutritional services at our sites as well.
Now, how different is that in children, right? When we talk about rehabilitation, everyone understands what that is, right? But when you're talking about children, it's a little different.
Yeah, it's a great question because ultimately when any of us have gone to rehab, somebody might put an ice bag on our knee, somebody might put us over on a treadmill. We're all independently working, still under the direction of maybe one person, right? Somebody's being stretched. In pediatrics, as we talked about family-centric, the families are part of the therapy. The therapy is only a small part that week of evaluating a child, making sure they're progressing, but also showing the family what exercises to do so it gets followed through at home. So what's very different is that it's one-on-one. So a therapist and a child, those sessions usually last an hour, and it's the family, the child. Sometimes the family doesn't have to participate, but a lot of times we ask them to participate, so we're guaranteed that the services will be followed up at home.
And I'm assuming that many of the children are at different stages in their cognitive development as well.
Absolutely. We call that episodes of care, and we generally keep children on service for about 12 sessions. And then we ask them to take a break to make sure that those 12 sessions are carried over at home, that they're actually still making progress instead of continue to build. There tends to be a consistency of progression when they're able to take a break after a series of services. Take a break, make sure they're maintaining where they are, and then start building again. It also has to do with attention and also family availability.
Absolutely. Let's talk about the medical day services.
Sure.
And I know you discussed that a little bit at the beginning, but walk me through what that is.
Yeah, so medical days for children that have skilled nursing needs. So if a child has a trach tube or a G tube, or possibly needs some type of direct nursing service on a regular basis, assessment care, very bad asthmatics will come into the program. I'll take you through a day. We pick the child up at home, bring them on site, and then from there what we generally do is they have nursing services. We have therapeutic rec, child life, provide more of a educational developmental model for our kids. They're all in a classroom, age appropriate, developmentally appropriate classrooms. And it's like a normal daycare in that they're having peer interaction, they're learning, growing, developing, and then we also sprinkle in rehab services as well, providing that, trying to make more of an educational developmental model for our kids.
And I'm assuming that, parents who are in that situation still have to go to work,
Yep.
still have to carry on, right, to
Yes.
provide for the rest of the family. So this is a very important, vital service. Otherwise, they may have to, quit jobs and be doing this at home themselves.
So true. And with nursing shortages that we are very aware of, having nursing services in the home, you have more call-outs in and harder to find nurses to do it. Our services allow us to centrally bring the kids in. I think what's even more important is it allows our special needs kids to have more peer interaction, just normal developmental, just kids being kids.
Let's talk about the locations. And I know you're spread out throughout southern New Jersey, but those are important, right? Making sure that those services are near you, so you could have that opportunity to, take your child for rehab, or if it's a medical day, they don't have a big bus trip to go to the services.
Great. Well, first on medical day, bus trips, we will not have any child on a vehicle longer than an hour to get to and from the program. Just it's a safety and a reasonable consideration. We have sites in Pennsauken. We have both a medical daycare in Pennsauken and an outpatient site. In Vineland, medical day, outpatient site. Washington Township, just outpatient. Marlton, of course, our hospital and an outpatient site. And Northfield, currently an outpatient site, soon to be coming, and a reason for our discussion today also. We're opening a medical daycare in Northfield in the Atlantic County area in Q1 of 2025.
So what's the capacity for that facility?
About 30 to 35 children in a program total. Again, we split them up to 10 children per classroom. Some sites have 4 classrooms, so we're able to have less children per classroom. But that's our capacity each site.
And what will be the hours?
Children are on site for 6 hours, so it varies. We may pick them up at home as early as 7 or 8 based on the family schedule, as late as 8:30, and then they stay into the program 2:33, 4 o'clock, but they're usually home by dinner time.
So one important question that obviously is a barrier for most parents is, how do you pay for this? That's a big consideration.
The medical daycare program is sponsored and funded through Medicaid, New Jersey Medicaid. So if you are a Medicaid recipient, which a lot of our families are absolutely, they can participate in the program.
And how about the rehab services?
The rehab services, we take all payers, including all New Jersey Medicaid patients.
Now, some children may also need specialty equipment, et cetera. You also help them to get access to their insurance to get that.
Yes. In our outpatient sites, we have things like wheelchair clinic, adaptive equipment clinics, in which we bring vendors from outside on site, get our children fit, work with the families to get all the paperwork completed and get it submitted. Medical daycare, we do that on site as well.
Now, I know that we have some undocumented parents that may not have insurance, et cetera. What are some of the options they may have?
What they would do is contact our admissions department. Again, we would try to find the best route for them to be able to receive services. It's not a reporting methodology. It's more of just communication and see if they are able to access Medicaid services.
What are some of the ways that they could get in touch with the services?
The best way would be to contact us through our website, which is weismanchildrens.com.
Let's talk about the Northfield facility. Is that pretty adjacent to the existing outpatient?
Yes, it's actually within 200 feet of the existing.
Okay.
It's in the same plaza. As in fact, we hope to be able to expand our outpatient in the existing space, so they will be actually right next to each other.
You mentioned the fact that the radius would be an hour, so that Northfield would be able to serve all of the Down Beach communities, as well as the mainland here in Atlantic County as well.
Absolutely.
Well, certainly, I know that this is a vitally needed services, and hopefully we'll continue to spread the word out that this services are available. We do want to talk about the equity issue because, in the Latino community, there's always those challenges and some barriers that have to be overcome. We're going to take a quick break and we'll get into that discussion.
Great.
We'll be right back with more Latino Motion.
Latino Motion with Bert Lopez is presented by Latino Motion Public Affairs Media, a New Jersey nonprofit corporation. Join us online at www.latinomotion.tv. Find us on Facebook and YouTube. We encourage your comments and contributions for show topics.
Welcome back to Latino Motion. We continue our discussion with Michael Rosiak. He is the Chief Operating Officer at Weisman Children. And Michael, we were talking about the great services you provide, both for the rehab services as well as the medical day. We want to talk a little bit about the equity piece of this, right? Because certainly one article that I found indicate that disabled Latino and Hispanic children often face significant disparities in healthcare access and quality compared to non-Hispanic, including diagnosis, fewer available services, and less comprehensive care. So there's a whole array of issues facing the Latino community in terms of overcoming some of those disparities and barriers such as language, et cetera. Tell me a little bit about how your program is helping to overcome some of those disparities.
Sure. I don't think it's only in pediatrics. I think it goes across the gambit of healthcare.
Absolutely.
What we focus on is, again, bringing the care into the community and building trust within the community. I think that my understanding of the Hispanic community is it's very family-oriented. So we really want them to understand that they can come in, see their son or daughter in a medical daycare at any time, feel good about the services that they're receiving, and feel comfortable that we're really a part of their extended family, if you would. As far as the family themselves and access to care, it's a challenge everywhere today. And the more rural the environment, the harder access is. The one thing I will say that has helped some improve that a little bit has been telemedicine and some access through telemedicine, but the families then have to have access to computers to have telemedicine. So we have worked with charities and organizations that are able to help put that in place as well. And lastly, for us, it's really important to have language lines available for translation services. Not only do we have staff who are bilingual and are able to provide services, both all the way from intake and admissions, all the way through care and direct care services, but we also have access to language lines. So again, they will help translate for the family to have a full understanding.
You mentioned the fact that it's building trust, and that's easier said than done, right? Certainly having the bicultural, bilingual staff is a big help. But I'm sure that you've already experienced the fact that there may be resistance, right, to allow their child to be in a medical day program. Maybe a lot of reluctance. How do you overcome some of that?
We try to introduce them to families that have experienced our level of care. I mean, to your point, we can only say so much if you don't experience it. So I think our patients, their families, that connection is something that we count on. And we don't hesitate to have them reach out to folks. It isn't like we handpick families. They can come in at any time and meet with any of our families. We're that confident in the service that we provide.
And I know you mentioned the translation lines.
Yeah.
Not a big fan of translation lines,
but
having the bicultural, bilingual individuals, certainly it's a big help. I mean, that's a lot more personable. It certainly helps to build the trust. And when I visited the violin office, I did see you had a great deal of bilingual individuals there that we're providing for the children.
We pride ourselves on cultural diversity. We have a DE&I committee. We stand proud by our DE&I committee. The people who participate in the committee help us modify and change policies. I mean, we live and breathe what we believe, and that's important. Again, we say there's no curtains in what we do. There's no secrets. It's transparent. So yeah, like any organization, people trip, but we'll take ownership of any of our shortcomings and try to make amends for it. So I think clear communication is the best way with families.
Let's talk a little bit about the children themselves. I mean, how do you feel that they adapt to this new setting, particularly a medical day program, right? They're away from their parents, maybe the first time. I'm sure it's a challenging time for both the parents as well as the child.
It's kind of like the first day of school, right? For kids going to school the first day. I think more importantly, it's our staff. We say this all the time when we have new employees. First and foremost, hire good people, you can make them good employees, right? Don't fill the position. So there's a pretty, to become a member of our team, we really put you through your paces because we want to know you're a good person. And then if you're in pediatrics for more than 18 months, you're in pediatrics for life. And so that's the population you want to work for. And for us, it's about giving our people, our staff members, tools to succeed. So things, different things culturally, or from lunches to parties and things like that, we need to be culturally sensitive to our whole audience. And they give feedback to us via town halls, they can pick up the phone through their manager and call me directly. So we listen. I think a lost art today is listening.
Yeah.
So we do listen.
Let's talk about going through the whole intake process, right? And obviously the bilingual, bicultural. Key to that, how difficult is it for someone that wants to get their child into a medical day program, for say, to go through that process, the application, the approvals, et cetera?
Well, I think the key to that is their primary care doctor.
Okay.
So they would contact, the family would contact us, but also we then would do a lot of work hand-holding with the family to reach out to the primary care physician, because they have to write the orders for the child to participate in the program. Again, we have very good relationships with most of the larger pediatric programs in the community. In the Atlantic County area, we do market and serve for outpatient services, so we know who they are. So a lot of times when they know we're calling, they do take the call and are active with us and trying to get a child in. It could be, I would say, probably maybe 4 to 12 weeks at the most. At least 4 weeks to get a child in, 12 weeks at the most. And that's because the insurance company does have to approve things as we put the paperwork through.
And I'm assuming that most of the referrals are coming from primary physicians?
And families. You'd be surprised how many walk-ins. We do a lot of the night outs in the community, and you just find out through word of mouth. We also work with the local Department of Health as they are in the communities and share our services. So people might just run into a neighbor who doesn't hear about us. Somebody may see the show today, not have a special needs child, but have a friend that does. Right. So word of mouth is really powerful for us as well.
And of course, you don't work alone, so to speak, right? You also engage in the community. Tell me how important that is to also engage out in the community.
We can't work in a silo, right? So we have to understand. We understand, food deserts. We understand the challenges that everybody faces. We try to partner with organizations that may have fresh food trucks coming in. Some of the larger health systems do that now. We want to understand what's available in the community, so we share that information. In medical daycare, we do have full social work services as well. So that social workers really connected with the family to make sure that we're having them have access, not only in our program, but for what their needs are holistically.
It sounds like you have all the bases covered. Looking forward to the opening for the medical day program you have in Northfield, and certainly continue the good work. I love the mission, unlock the potential of every child every day. Michael, thank you so much for sharing this information with our audience. And unfortunately, that's all the time we have.
Thanks for having me, Bruce.
Thank you for joining us at home once again here on Latino Motion.
Funding for Latino Motion is provided by Atlanticare. For more information, call 1-888-569-1000 or visit atlanticare.org. Atlantic City Electric, energy for a changing world, and South Jersey Gas.